All right, hello and welcome to another episode of Douglasville Impact, our community podcast. We are coming at you with a lot of great information today. We usually like to have a lot of fun on this show. We're still going to have a little fun, but we're going to talk about a lot of serious information, a lot of serious things going on in our community. So we're going to talk about some facts about what we're doing as a city, what we're doing as a community, and what you guys can do at home to help protect your families and your communities. So let's go ahead and introduce everyone we have at the table. I'm Jason Post, City of Douglasville, Community Relations. To my left is Miss Sara Ray with the Douglas County Chamber. Mr. Travis Landrum is our Parks and Recreations Director. And at the end of our table is Dr. Debi Dalton with Wellstar Douglas, correct? Yes. Excellent. So really cool panel of people with a lot of great information at the table. Thank you guys for all joining us.
Thank you.
You're welcome.
So we're going to start off real quick. We're going to cover a little bit of city information, where we are as a city, some of the things that we're doing to adjust to our current situation with the COVID-19 everywhere. And then we'll move on. We'll talk a little bit about the health aspect, the parks, and our community businesses and what we're doing. So from a city point, we had a meeting yesterday. Travis was there. All of the department directors, mayor, and city council all came together to talk about the situation and what we could do as a city to help protect the community, basically, and our staff from the spread within the city of Douglasville, Douglas County. So, what we're still trying to push the idea of the social distancing, which is just keeping to yourself, trying to stay away, minimizing your contact with large groups of people. So, with that in mind, the city has closed all of its city facilities to the public. Now, with that said, we're all still here working. We're not shutting down the government or anything. All the employees are still reporting when we can, and we've got things in place for remote working when we need to. We can work from home if we need to. Things that we have in place to keep the city functioning. We're still providing all of our city services. We're still in the buildings taking your phone calls and taking your emails. Sanitation service is still running. The police is still out in the community doing their thing. We're still here. You just can't come into City Hall and talk to us. That's the main difference. But with that in mind, our website has all of our city services. A lot of our stuff you can do online. You can apply for things online, fill out things online, submit things online. There's contact information if you want to call and actually talk to somebody. You can reach out to us via our Facebook page and our social media, and we can get answers if you have any questions and things like that. So there's a lot of information on the website. But the bottom line is we're still here. We're still here working. Now, one of the other parts is our parks. So we got Mr. Landrum, our Parks and Recreation Director, in today to tell us a little bit about the state of the parks, because that also applies to the parks. So tell us where you guys are with all of our city parks and recreation.
Good afternoon. So as of effective today, our Parks and Recreation Department, our operations will be suspended until March 30th, which includes closing our facilities, our athletic programs, any services that we currently had scheduled. The public will not be allowed to enter into those facilities. We're, of course, with the pandemic, promoting social distancing, and but we also understand that there'll be a little bit of cabin fever with the kids being out of school.
Absolutely.
And we'll understand that the parents will want to get out and have some type of release with that. We're allowing them to still come into the parks because we can't necessarily close our parks because of the structure and the setup. But we're still encouraging them to not get into that group of 10 or more, keeping social distancing, things of that nature. So the amenities that can be secured, our bathrooms, our tennis courts, our baseball fields, those will remain secured, but the playgrounds, our walking track, such as at Hunter Park, will still be available.
Right. So and that's actually like the walking trails is a great option where if you are getting all cooped up, you got the kids, you can get out and you can go outside and be outside and not still being around people or anything. So that's a good opportunity to get out.
Correct.
And enjoy some of the amenities that are still available.
Yes.
Like last weekend, my family went out to Sweetwater Creek. It was awesome. The parking lot was crowded because people wanted to get out of their house. But once you got a parking space and got out of your car, nobody was around. You got out onto the trails and it's like empty, right?
Correct.
So it's a great option to get out, get into nature, get some fresh air, and still not have to be around a whole lot of people. So,
Correct.
What about West Pines? We want to talk a little bit about West Pines as well.
Yeah, so West Pines will fall under the same parameters that we have with the remainder of our parks. But the community, if they're interested in continuing to get in a couple swings and play some golf, they're able to walk the course, but they will not be able to go into the course and register tee times or get a golf cart, things of that nature. So the golf course is, in a sense, open to the public, but not open for regular business operations.
Yeah. You got to walk, and you got to come out with a good spirit to work with whoever else is out there. There's no tee times. You just got to be friendly and polite and get along.
Correct.
Right.
So to your point earlier, you'll still see our maintenance crews out doing their regular routine maintenance. You'll see maintenance on the golf course. So you'll still see city employees in action, but they'll be operating in those single capacity where it's not a lot of people involved or a large group effort.
Yeah, absolutely. And because in the end, we're just trying to make sure that everybody's safe. We want to make sure that the staff are safe,
Correct.
And the community and the citizens are safe as well. So
Absolutely.
to that end, I think we got a notification today that all city events and meetings are now going to be postponed through the end of April.
Mm-hmm.
Okay.
So that is fresh information.
Yeah.
Hot news.
Hot news right off the presses. This just in. So we've made that call through the end of April in an overabundance of caution. That's the phrase we're going very accustomed to. We just want to be safe and want to make sure that the community is safe, really. So
Correct.
that's going to be through the end of April. All our events, activities, meetings, just to be cautious. So with that in mind, like I said, we're trying to stay safe. We're trying to distance ourselves as much as possible. But at the same time, the flip side of that is we have a lot of small businesses and stuff in our community that they're really stepping up to try to help to serve our community in certain ways. So what can we do? Well, tell us a little bit, Sarah, about where we are in the
state of
community.
business in Douglas County.
In Douglas.
It's an ever-changing environment, and I feel like I'm very proud of all of our businesses, even our large employers and our public entities, of how everybody has kind of, adapted so quickly to new and different. And that is kind of what we are dealing with at the chamber.
Constantly changing.
Yes. So we were kind of chatting about this before, but gone are the moments of networking events and large group meetings. So we're adapting our model to accommodate what our members and all businesses in Douglas County are really needing right now. And a lot of that is support, and it looks different for every person. So what we are encouraging our business community, and that is members and non-members, we see no lines in these times. Mm-hmm. So we are encouraging everybody. There's a survey that is on our website. It's on our Facebook, our social media platforms, and it's basically a business impact survey. So that's helping us assess the direction and be able to identify how we best can serve individual businesses. So, a lot of it comes back to the results have been seeing, being able to adapt to selling their business or their service online. Mm-hmm. Some of the struggles are with workforce. Some of them are with financing, which I know we can chat about for a little bit. So we encourage the businesses to, and I am literally reading every single survey so that we can make sure and accommodate those needs. Absolutely. So that's kind of what we've been dealing with. And the best way for us to know the struggles with the businesses immediately is to be able to take that survey. So we also have kind of based on that feedback, we have created a few new opportunities, resources, and platforms for businesses and people in Douglasville and Douglas County to kind of support our local economy. So the first thing that we've done is we have a website. It's on our chamber website, but it's douglascountygeorgia.com/DouglasStrong. Right. And on that, you can find local, state, and federal health updates. You can find business resources, and that's that includes teleworking tips and different platforms. If you need to put your QuickBooks online, then the information is there and how much it costs, or if you're looking at video conferencing, all of those different new ways that we're all having to adapt to as far as staying open and staying there for business. There's also a list of our restaurants, which I'll touch on that one in a second. Yep. And then there's some other resources for nonprofits. So that's kind of our go-to source. There's also information from the Small Business Association, the U.S. Chamber, and basically any other information that we receive. So if a business is looking for something on, the legal checklist list of things that they need to be doing now, that's on there. So, so we have that platform that as people are sending us stuff, we're adding it probably hourly at this point. So if anybody has any information, please feel free to send it our way. And then the last thing I would say, well, one of the newer things that we've been working on is on our Facebook, or I guess on Facebook, we have created, it's called Douglas County to Go. And it is a platform that has received an awesome response, overwhelming response in the last, I think we're close to 500. And that was when I checked earlier this morning, close to 500 likes since about 6:30 last night. Yep. And we have a team of our chamber staff and volunteers that are pouring information on local restaurants that are offering delivery options, retailers that are offering free shipping, pharmacies that are offering free delivery, other organizations that are offering support services for seniors or, you know, for pregnant women, whatever the needs are. So, so that is kind of one of our sources as far as updated information on how you can continue to still support our local businesses. So if you just go on Facebook and just Google or search Douglas County to Go is where all of that's at. So those are a couple of things. We've got more in the pipeline, some virtual meetings, webinars, those kind of things to help continuing to support our businesses. But it all looks very different now than it did even less than a week ago. So
and that one's awesome because I think it's really awesome to look at a lot of the small businesses and the local businesses and see all the things that they're doing to step up to try to help the community. They're trying to offer for the delivery services, the pickup services, the curbside stuff, the online services, the retailers that are opening an hour early or designating an hour for seniors or the more vulnerable shoppers to come in when there's not as many people around, things like that. So you see the businesses stepping up and we really want to look and say, well, so now what can we as the community do to help those businesses? Because they're going to really be hit hard from all of this. So I think that's a great resource. We'll put it on the show notes. We'll put it on our website and stuff as well. So that's a great one-stop shop where you can go and see where to get your lunch or whatever. I can get a blooming onion delivered from Outback.
In like 30 minutes. Wow. It's great. We're already planning on shopping local tonight and ordering dinner before I head home. So
that's awesome.
It's a cool way to still support the local economy. And I know the small businesses so appreciate it.
Yeah, well, that's what's cool about Douglasville and Douglas County in general. The people that always just come out of the woodworks to say, how can we help? What can we do to help? What can we do to make things better? So that's always great. Yeah. So, well, like you said, there's always new information coming in.
Yes.
And it's always changing as of today or yesterday. I know that the information on this situation is coming in like a fire hose. I know the mayor was on a call yesterday with the governor's office, with the governor, one this morning with the county officials and key representatives. She was on the phone earlier when I left her in her office with the White House, with the vice president, talking about the same situation. So we're trying to stay informed about all the different levels and all the different things happening around this situation on the national level, state level, regional level, county and city. And there's a lot of information. So we've got Dr. Dalton here today with us to boil down the basics of what people need to know about this COVID-19. There's a lot of people out there who are getting a lot of information via Facebook and via the internet. So we want to get some basic facts to help alleviate some people's fears and just to let them know what they can do to help protect themselves, their family, and their community. So thank you for joining us, Dr. Dalton.
Welcome. So one of the things to keep in mind is a new virus. There's a lot of things we don't know about it. It is acting like a lot of viruses, but still it's a new virus. It seems to be very easily spread from person to person, so we're very cognizant of that. And there's not a lot of treatment, or at least we didn't think there was any treatment for the longest time. Now there's some information coming out that there's some new treatments that are coming out for patients who are really sick. The big thing that we need to tell the community is to quarantine, self-isolate, avoid large crowds. That's the easiest way to stay away from the virus and not spread it to your loved ones. If you think that you've been exposed, to quarantine yourself, self-quarantine, stay home for 14 days. And I think everybody's very cognizant of that issue,
Yes.
and very understanding that if you think that you may have been exposed, that it's okay to stay home.
Yes.
We'd actually appreciate it if you did stay home.
Everyone would.
Right,
And that would help. Yes,
and certainly
that's
people
exactly.
we have families who get exposed as well too. So if you think you're exposed, well, then you're going home and exposing your family too. So if you really think that it's a good enough exposure to isolate yourself away from the family, the rest of the family as well too, make sure that they have their needs, of course. But washing your hands frequently, don't touch your face.
Absolutely.
And Clorox bleaches, Clorox wipes are wonderful. So kind of any doorknobs that you touch or handles on the refrigerator.
Yeah.
Things like that are you touch all the time, don't think about, but you could spread it that way. So just making sure that you're keeping your house clean with disinfectant, not just the normal way that you clean your house, just being a little bit more aggressive, of course.
Hopefully, as a society, we're going to come out of this as a much cleaner group.
Sanitary
in general.
group. Yeah.
I think it will definitely
We'll all know
change
how to
the way
wash
we
our
look at
hands
things.
now.
I mean, you think about people who have strep throat. We always tell them stay home, don't go to school with
Yeah.
fever. But people certainly don't follow those recommendations,
Yeah.
and spread strep. We see it in the schools all the time. So
Yeah.
I think we'll be a lot more cognizant about how we spread diseases,
Yeah.
and I think when we get out of this, we'll come out better as a society.
And that's where, as we've been talking about all these different measures we've been taking, the key thing that people can do, and this is what we want to make clear, the most important thing that anyone can do is the social distancing.
Yes,
Just to
absolutely.
stay away, manage where you're going and who you're coming in contact with. Try to reduce that contact as much as possible.
Right.
If you can work from home, work from home. If you can stay home, stay home. And then, like you said, if you've come in contact, the recommendation is
If you've come in contact with it, you think that you've really come in contact with it, to quarantine
Any
yourself.
question.
And then any question.
Quarantine
yes.
yourself.
To quarantine
14
yourself.
days.
14 days.
Okay.
It replicates, the virus replicates without any symptoms whatsoever for about 14 days, I think. So it could be a little bit less, but it could be a little bit
Sure,
more, but around
sure.
14 days. So just if you get to the 14-day point, you're pretty
err on
sure
the
that you're
side
not
of
going to get
caution.
sick.
If you
Right.
think you may have come in contact with someone, just
Right.
stay home if you can.
Right.
Now, if you're starting to show symptoms,
Yes.
maybe so the symptoms are what?
Fever, coughing. There are some people who had some GI symptoms, some gastroenterology issues. So they were having some vomiting, some diarrhea too. So, be aware that it could be this, but it could also be the typical things that are causing that.
We still have
as well,
flus
too.
out there.
So, yes, exactly. So it's still
Yeah.
flu. There's still rhinovirus and adenovirus and all these other viruses, even
Yeah.
plain coronavirus, the regular, the
Yeah,
run-of-the-mill
I think that's
coronavirus
confusing
is out
people
there
as well.
too. It is.
Yeah,
It is. So that's why
yeah.
we've renamed it to COVID-19, so that
Right.
you're not confusing it with the typical coronavirus that people get.
Right.
You just get a bad cold from it. So, and it's not so much you have to run to the hospital, run to your doctor if you get those symptoms, but be aware that you're sick. And if you get sicker, then of course you need to look for care,
Right.
And that could include seeing your doctor, your pediatrician. I'm sorry, I'm a pediatric emergency physician, so I always default to that.
We worry about the kids. No worry.
Kids can get it too.
We all
That's
have
right.
kids.
Definitely, kids can get it too. Kids, we think, don't get as sick as older people do, so you have to be aware of that as well too. But just symptomatic treatment: Tylenol, Motrin, lots of fluids. You can use some of the typical over-the-counter Benadryls and those kind of things for a bad runny nose, a stuffy nose. But most people are getting a little bit of runny nose, coughing. The coughing is what really gets people. It gets very,
Really?
very bad. So
Okay.
that's usually what makes people look for care, is when they start coughing. They
Fever,
worry about it.
coughing,
Runny nose,
shortness of
sore throat,
breath,
shortness of breath, yes.
sore throat, something like that.
And,
Okay.
and older people who have other, comorbidities like heart failure or COPD, emphysema, those kind of things,
Right.
they might be hit a little bit harder. So
Yeah.
we'd be a little bit more sensitive to the needs of those patients because they're going to need more aggressive care.
Right. And so what they're saying right now is those are the ones that they really want to bring to come in and to get tested. If you're over a certain age, if you have some risk factors, if you're showing symptoms.
So the problem with the testing is that we don't have enough tests.
Right.
So they are coming. We don't know exactly when, but they are making more so we can get them out to the communities. I personally feel it's very important to test people who are not symptomatic at some point when we can get those tests,
Once we have
because
the,
you
supplies for
may
it.
have it
And not know.
and not know it. So
Right.
and that's why we're telling everybody to stay away from
Stay
everybody. So
away.
this is the most prudent thing that we can do right now. So at this point, the people who are being admitted because they're that sick will get tested. And we were using the Department of Public Health as our resource. There are more tests now with Quest and LabCorp, so there are other tests that are available. They're a little bit quicker, but we do, try to be careful about which test that we're using,
Right.
so we can get the right answer at the right time and treat patients appropriately.
So for the majority of folks, so we talked about the severity. For the majority of folks, the kids and the younger, the healthier, you're going to get these symptoms. The recommendation for those people are going to be to isolate yourself.
Isolate.
Contact your regular healthcare provider. Let them give you some advice and let them tell you what to do.
Right.
Don't rush out to the hospital.
Right.
Don't rush out to try to find a testing center or something. Just contact your regular healthcare provider. Isolate yourself. Let's talk a little bit about the difference between quarantining and isolating. So if you have the suspected thing, if you think you've been around someone and you're trying to quarantine yourself for 14 days, that means
you stay home. As much as you can. I mean, certainly you might have to go out for supplies, but definitely as much as possible, stay home.
Yeah. Now, if you've started showing some symptoms and you need to isolate yourself, that's a little bit more.
Stay in your room.
You stay in a
wear
room.
Gloves. You wear a mask. Originally, we were talking about the N95 masks that everybody talks about in the news. They're a short supply for sure, and we did downgrade. But the CDC did downgrade it to a droplet isolation rather than airborne isolation, so you can wear a surgical mask. It helps to a degree. It certainly helps you keep from touching your face. Right, exactly. So at least you're aware that you're not touching your face and spreading it.
I never realized how much I touched my face until the last couple
Nobody
weeks.
does.
And then you do it and you're
Nobody
like,
does. So
Ever.
So in general, though, if you're symptomatic, isolate yourself. Contact your healthcare provider because they know your history and they're going to be able to tell you, well, you've got this kind of background. We need you to go ahead and come in a history. Or looking at your age, well, we need you to go ahead and come in and get tested. Or they may say you're healthy, you're young. Just isolate yourself, stay home.
Younger people are going to feel achy and they'll just not feel good, just like the flu. There's only symptomatic treatment at this point. But if you're really sick, then there's some more bigger guns, so to speak, that we can give patients who are hospitalized who need that medicine.
Yeah. And there's a whole level of it, and that's why we want to make sure that you don't want to downplay it because people may not have, a big reaction to it. You don't want to downplay it because there are people who are going to have a serious reaction to it, or it can compile with, you may get the regular flu, and then you can get this on top of it, and now it's serious even if you're young and healthy.
Right.
Something like that could still happen.
Exactly.
And you still are a carrier even if you're healthy and not, and you could infect someone who is older, who is a little more susceptible. So it's that part that we're really concerned about. So there are reasons to be concerned. There are reasons to take this seriously. But then on the flip side of it is that there are ways to protect yourself. There are still ways to go out in the community and visit the local Outback and pick up your food, bring your bloomin' onion back home. Sorry, I saw the bloomin' onions earlier, and I can't get them off my mind. So
you can order it. And
you
we'll
can
be here
still
in
do
20
that,
minutes.
and there's ways to do that safely.
Right.
And that's what we're, so we don't have to completely isolate ourselves if you don't have a reason to necessarily. So,
but at this time, the community just needs to know that don't go to the emergency department because A, you're exposing yourself. B, we don't have the test to test everybody right now.
It's no good to just run off.
And as we liberalize the testing and we have more tests, we're certainly going to be doing that.
And they're developing new things. I know when on the call we were just on with the White House, they were talking about new tests they're trying to develop. So there's new stuff coming down the line.
Exactly. Every day something new.
Every day it changes.
Seems like every couple hours there's something new. So
I'm assuming on this podcast that a lot has changed.
Probably by the time we started, it's all,
Well, can I add one thing too? I know one of the things some of the feedback that I've been getting from different businesses and just people in general are how can we help, right? So if it's helping, with the hospitals or if it's helping people who might, with childcare. And there are two things that I know that I've seen that have been really good resources of ways for people to contribute that are safe and well proven. And one of them is going and donating blood because there's been a serious shortage. I know that the hospital has 2 blood drives coming up next week. Mm-hmm. We're in the process of scheduling a few more here in Douglas. They're having, they need blood.
Yeah, I've seen that,
we're in a severe shortage.
It's a severe shortage.
And because of all this going on, we suspect it's going to get worse. So if that's something that you're capable of doing, we'd encourage you to do that.
And please do not be afraid to go donate blood. I was on the phone, obviously,
this is a
today.
Situation where people are
she's going to appreciate the shout out. But don't be scared about going to donate blood. They have got plenty of medical precautions in place to screen people so that you're not exposed. They're also appreciating social distancing and making sure that they have large spaces. The other one that I think is very important is that the United Way of Greater Atlanta has created a response and recovery fund. So if you feel in your heart that you want to be able to give back back to people who are struggling with, those seniors that can't get meals, or if it's, people who are being displaced from work and those kind of situations, then we have all that information on our website. But that's an easy way, because you can just go and link it and pay and be done, and know that it is staying here in Metro Atlanta.
And that's what I was saying. That's what I love about Douglasville, Douglas County, is they immediately stand up and say, how can we help? What can we do? And you have all the community organizations like Kaya and things like that are providing meals for kids and things like that come out of the woodwork to say, how can we help? What can we do in this situation to help the community?
Yeah.
Love that.
Those are just two high level ones, but those are, I know, definitely things that are in need. So.
Or even the school board, the stuff that the school board is doing while the kids are out to feed the kids are awesome. It's amazing. And I know they just talked about when you come now, they've got it set up to where they're doing a meal plan where they're giving you a whole week worth of food and supplies for the kids that you have in the car. So you only have to make one trip a week.
Yeah.
It's those kind of things. It's awesome to see the community come together.
We're fortunate to not have to utilize that, but maybe I should, just so then I don't feel like I know the kids are good for the week. I'm kidding. I won't do that.
Yeah.
But it's an awesome resource.
It is awesome. It's awesome how all the community organizations, the like I said, the governments and the private and all the charitable organizations are all coming together to try to help. So it's all good. For all the constantly changing information, we can go to the Chamber's site to see. Definitely go to Douglas to go.
Douglas County to go.
Douglas County to go, and find out all the places you can go for dinner and lunch and services and pharmaceuticals and everything. Right?
I'm just waiting for virtual haircuts to happen. That's the next one coming. I'm sure there's got to be a way.
So definitely go there and find out, and then visit the Chamber's regular site for all the information. We have a wealth of information on our douglasvillega.gov. We have a information center specific for COVID-19 information. So all the updates related to this will be on that page. You can find it right on the front page of the website. So any of the cancellations, delays, buildings closed, events postponed, all of that information, the new information coming out from the state, from the CDC, from everywhere, every information we're getting is all going there. So we're going to put it all there. And the bottom line that we are trying to get out to everyone is we're trying to subdue the fear in general, because we know that if you're exercising the right methods, if you're exercising the distancing, and
you're exercising
in general, if you go out to a park and go for a walk, just do some general exercising. That's good. And you don't have to be super afraid of this if you're taking the precautions. It's one of those things where we can take precautions and still be safe.
And it's short-lived. We'll get back to our normal lives eventually, but this is really important to just isolate and quarantine and don't touch anything.
Yeah. And that's easy enough. Like I said, I'm an introvert. I've been practicing that for years.
Yeah.
So the best we can do is just to be cautious, err on the side of caution, and just know that when you see the government's doing these things, we're preparing for the worst. We're still hoping for the best. We're hoping this thing is even shorter than we're thinking. So, we're here to kind of serve. Keep an eye out on our websites for updated information. Always feel free to reach out to us with any email that you find on the website. Call us if you want. If you find a phone number on the website, everybody's contact information is there. Our social media pages. Allison Parker, our social media coordinator, is constantly in contact with people.
Yes.
If you've got a question, a concern of any kind, you can post it to our Facebook page. You can send us a message. You can send us an email. Whatever you need to do, reach out and we'll get some kind of answer for you. Like I said, it's constantly changing information. We'll get you whatever the current information we have or connect you to the right people so that we can all come together and just help everybody to be safe. Like I said, it's something that we just need to take the appropriate level of caution and we can continue to move forward and we're going to be okay. So anything else anybody else at the table wants to say before we wrap up? Thank you guys all for coming out.
Sure.
Very welcome.
Thanks.
Yeah. All right. Well, thank you again for joining us. Thank you guys for listening. And again, if you have any questions, please feel free to visit our website, visit our social media, and we'll see you next time on Douglasville Impact.